Heart disease is a leading cause of death in women over 40. The American Heart Association says that 60% of black women over the age of 20 have cardiovascular disease, and they probably don't even know it. Vitamin deficiencies, hormone imbalances, perimenopause, and mental health all top the women's health list. If you're anywhere near 40, this video is for you. Hi, my name is Crystal of Crystal Couture, and welcome back to my channel. Now, I'm not here to say that most of you don't go to the doctor, because I truly believe that you do. What I am here to say is that most of you all do not know how to engage and manage your doctor's appointments. You're basically spectating. Now, I understand the average appointment for orthopedic lasts about 6 minutes. And for primary care, about 10 minutes. I've been a doctor of physical therapy for over 15 years and have spent most of my time educating my patients on how to navigate this short time with their doctor. As a woman, especially a black woman, it is imperative that you are engaging in proactive dialogue with your physician. Let's talk about a few questions, tips, and even conditions that you should be discussing with your physician. Making a list. 9 times out of 10, you already have a lot of questions that you've been thinking about that you want to ask your doctor, because it's probably already been a year. Making a list that you can keep with you of symptoms, of conditions that you think you may or may not have, of how you've been treating the symptoms that you've been having, are all good things to have with you on hand when you go to the doctor. Ask about heart disease. About 60% of black women have high blood pressure, one of the major symptoms of cardiovascular disease. That means that only 2 in 10 black women have their blood pressure under control. In addition to the doctor checking your weight, make sure he checks your BMI, then ask to get your cholesterol checked, your A1C, as well as your hemoglobin levels. Next, let's ask about mammograms and cervical cancer screenings. True, breast cancer is the most talked about cancer amongst women, but cervical cancer is also another one of the most common cancers found in women between the ages of 40 and 60. Cervical cancer can actually be prevented when you're younger via the HPV vaccine. Strokes. Women have more strokes than men, and I can definitely attest to that being out in the field. Research has shown that women are at greater risk over 40 years of age, especially if they've been given hormone replacement therapy before, during, and after menopause. Unfortunately, black women are twice as likely to have a stroke than white women, and our symptoms are more severe. So, with that knowledge, talk about where you are, talk about where you need to be, and then schedule a follow-up to make sure that you're on task. The first hour of stroke onset is vital for treatment and recovery. So, remember these warning signs. Fast. F. Facial drooping to one side when asked to speak or smile. Ask them to raise their arms, one arm drooping or one arm unable to be lifted. S. Speech. Slurred speech or difficulty getting words out. And T. Time. Call 911 immediately. Perimenopause, menopause, hormone imbalances, period. Let's talk about them. There are many hormones in the female body you need to know and ask your doctor about. Estrogen, progesterone, testosterone, thyroid hormone, and follicle stimulating hormone, also known as FSH. Like a scale, in order to be balanced, each of those hormones have to be at the correct amount, or else you're going to have hormone imbalances, which lead to an array of strange symptoms. The Johns Hopkins Institute defines perimenopause as a natural process in which your ovaries stop working, and menopause as a natural process in which your periods end. Signs and symptoms of perimenopause can start up to 10 years before menopause. So all this discourse about women do not begin perimenopause until their 40s is just not true. A New York Times article written last year did an analysis on all of the research done thus far on perimenopause and black women. These studies showed that black women transition into perimenopause earlier, have more severe symptoms, and have a longer transition through both perimenopause and menopause than their white counterparts. These range of symptoms include insomnia, brain fog, irregular bleeding, and heart palpitation. If you're having any of these signs and symptoms, no matter your age, definitely bring it up to your physician. I hope you're enjoying the video, but I've noticed that over 90% of you that watch my content are not subscribed. So it would really help me reach more of you if you would hit that subscribe button. Thank you so very, very much. Now let's get back to the video. Gut health, gut health, gut health. Super, super important and often overlooked. The gut microbiome is an integral part of your overall health. It sends messages to and controls the immune system. It correctly metabolizes and absorbs nutrients, as well as protects the body from invasions from pathogens. Studies have shown that the gut and the brain have a direct biocommunicational system in which the gut talks directly to your central nervous system. That's why we call it the second brain. The gut microbiota in women plays an integral part from the time you were born to childhood, and during puberty, when the sex hormones come into play, they also begin to influence the gut microbiota as well. As you get older, a lot of the gut bacteria start to decrease and the gut itself starts to reorganize in new patterns. Studies show that your hormone levels influence these patterns significantly. Studies have also shown that the gut microbiome plays an integral part in a lot of the diseases that affect women, such as polycystic ovarian disease, certain female cancers, and then a lot of the postmenopausal diseases such as Alzheimer's, bone diseases, and postmenopausal obesity. Modulating your gut microbiome as a preventative and a therapeutic solution needs to be accomplished when you're talking to your doctor to ensure that your gut is functioning at optimal level. In general, enriching the gut microbiome with good bacteria at the expense of the bad bacteria is the overall goal to promote good health. Other tips include eating healthy, managing your stress, getting enough sleep, practicing mindfulness, and exercising. Monitoring your cortisol levels should also be discussed with your physician. This commercial break is brought to you by Jake. He wants to continue to drink water throughout my filming session. We shall wait. Now we can carry on. Cortisol is a steroid hormone that regulates a wide array of processes throughout the body, including metabolism, the immune response, and plays an important role in how the body responds to stress. Cortisol levels can be checked via a simple blood test, and normally it's higher in the morning and then it falls throughout the day, unless you work nights when it's the reverse. Symptoms of too much cortisol can present as rapid weight gain that you can see in the face, abdomen, chest, between the shoulder blades, or mood swings that can be followed by anxiety, depression, and irritability. Too little cortisol is a little bit more gradual. It presents as fatigue, dizziness, especially upon standing, dark spots on the skin, general weakness throughout, weight loss, and mood changes. With this wide array of conditions that face women daily, especially those over 40, the most impactful question or request that you should have when speaking to your physician should be to ask for a full panel blood test with a female hormone panel included. A full blood test panel should include a lipid panel, which is HDL and LDL, basically your good and bad cholesterol, a basic metabolic panel to include blood glucose, calcium, electrolytes, as well as potassium, carbon dioxide, sodium chloride, creatine, your blood urea, nitrogen, a comprehensive urinalysis, a complete blood count, including prothrombin time, and any immunizations that you might be missing. Your full hormone panel should include the follicular stimulating hormone, the luteinizing hormone, estrogen, progesterone, testosterone, the sex hormone binding global hormone, as well as thyroid hormones TSH, T4, and T3. Now, it's going to be your job to ask when these results will be available in your portal or wherever you check your medical records. And when they're available, will the normal values also be presented so that you can compare and contrast if you're normal or not. Then it will be up to you to schedule another follow-up, which I would do before you leave that office a month from then, with your physician to discuss your results and to prepare a plan moving forward. Being proactive and informed about your health and your body is more than just a choice. It is a requirement, and it's completely up to you to do so. This video should not be taken as medical advice or should be consulting with your physician all your medical questions. This is just the research that to keep you informed and proactive. Please share with me your experiences and any questions that you may have in the comments. Don't forget to like and share this video with a friend, and think about subscribing for more wellness, fashion, skincare, and lifestyle content. Thank you for watching this video and taking the time to choose your health. Thanks again, and I'll see you in the next one. Bye.